can't go on business as usual. Welcome to Health Issues 2010. I'm your host, Chris Sylvain, and believe me, we are excited. This is a different show. It's one I think is probably the most important show that we've ever done, and I will say this seriously. We're here to talk about, the issues facing New Orleans, and particularly New Orleans and even Louisiana, and the conditions that we're in. But we have two great guests here today, and we're going to talk about social work and its implications in solving many of the problems that addresses the health crisis, and it is a health crisis in New Orleans. We have Ms. Carmen Weisner. She's the Executive Director of the National Association of Social Workers, Louisiana Chapter. Welcome, Ms. Weisner. We appreciate you. She is a social worker at LCSW, ACSW. We also have Dr. Sonia Gilkey. She's Assistant Professor over at Tulane University. She's a social worker, also LCSW, LCDR. She'll explain what that is, MSW. Welcome, Dr. Gilkey.
Thank you.
Well, we're excited to have you both. And very, very serious issues, when we look at New Orleans, and that's what brings us here. New Orleans, if we even tease out some of the areas, look at New Orleans East, we look at life expectancy. The life expectancy of a male in New Orleans East is lower than that of Iraq. If we look at infant mortality in Louisiana, we fall under Russia, under Cuba. If we look at so many of the health indicators, in our city, it is literally worse than many third world countries. And things can't go on the way they are. But when we look at these health indicators, how bad it is concerning human rights, if anything else. We have a profession here that is trained, are in number, designed, ready and willing to address the issue. And we have 1,000 in the city of New Orleans alone. And that's social workers. And that's what we're here to talk about. We're excited about that. But first, let's talk about who you guys are. Ms. Weisner, tell us about your job.
I'm the Executive Director of the National Association of Social Workers Louisiana Chapter. And NASW itself is the largest professional association for social workers in the country. And in Louisiana, we have 2,500 members of the association. There are over 7,000 social workers that are licensed in the state. We have several social work programs. It is a unique profession. We have the schools of social work who train social workers at the bachelor's level all the way through a master's and a PhD program. So we have unique training venues available to social workers in this state, in the northern part of the state, in the central part of the state, in the southeastern part of the state. The social workers work in a variety of settings. They work in healthcare settings. They work in with home health agencies, hospice agencies. They're working in hospitals. They're working in our schools. They're working in the courts. They're working in child welfare. Some of them have their own private practice. Yeah. Many of them are administrators of nonprofits, or they have they do advocacy work. I myself am a registered lobbyist in the state, and I pride myself in terms of sometimes we're able to speak for those who cannot speak for themselves.
Wow. That in and of itself is powerful. Thank you. Dr. Gilkey, tell us a little bit about yourself.
Yes, I am assistant professor in the School of Social Work at Tulane University. teaching graduate students there. I also have a project in East Africa, in Rwanda actually, that is a certificate program for professionals in Rwanda who want to get more education and skill development in the area of social work, and specifically in the area of social work to work with people living with HIV and AIDS. My primary practice and research experience since 1992 has been with people who are homeless or have a homeless experience, and children and families with complex trauma histories. I've worked in child welfare, I've worked in mental health services, I've worked in HIV services, I've worked with child and youth programs, I've worked in schools. I've kind of done a little bit of everything as relates to all of those different areas that you might find a social worker. So I have experience and knowledge in many areas of social work, but right now I'm in academia teaching and really trying to help establish more academic community partnerships in the city of New Orleans with the School of Social Work at Tulane, as well as working collaboratively with other schools across the city who have a social work program, whether it's at Loyola, who has an undergraduate social work program, Dillard has a social welfare program, and SUNO, who has a social work program, I believe, at the undergraduate and graduate level.
That's right.
Yeah.
Awesome. Well, when we look at the problems in Louisiana and New Orleans, you guys are so well suited to be able to address it. If we flooded the city with doctors, we may move the indicators a little bit. If we flooded the city with nurses, we may move them somewhat, pharmacists somewhat. But you guys are trained to actually deal with the issues that are causing New Orleans to be at the bottom of all of these indicators. You know, we failed to say we incarcerate more people than any other city in the world in New Orleans. But social workers can get in and make a difference. Tell us a little bit about that. Start off.
The way the social worker approaches their work is we work with the person in their environment, in their community, and try and, as best we can, approach it from a strength-based perspective. We look at, what are the positive aspects of that person's life and situation, and build from that, but try and connect them to whatever community resources we need and they need, and identify the deficits that exist in the community. What we don't want to do is take on the role and disempower the individual. We want to work with the individual so that when we are no longer involved in their lives, that they feel empowered to be able to access those services directly. We think our training at the bachelor's level, master's level, and PhD level suits us to be able to be a partner with our clients in terms of helping them access and interface within certain situations. We sometimes try and even advocate in the community where there's a social justice issue or social injustice issue. Louisiana itself, we think we're unique in the rest of the country, but we rank 49th in terms of child well-being indicators. Our children aren't faring very well in this state, and we need to do things differently. And we want our profession wants to be part of the solution of doing those changes to our systems that will change the outcomes for our children and our citizens.
Well, the access point for health, when we think about health, is the primary care clinic. So the concept is social workers in primary care clinics, whereas they can be referred by physicians, they can go in themselves. Currently, social workers are in a lot of places, but when we go to clinics, we don't normally find social workers. Tell us about this concept.
Well, it is a concept that, to my knowledge, is used in our federally qualified health clinics. And we see in federally qualified health clinics that they are being used in some of the rural areas in parts of the state. And they work with the medical team in those clinics to help the patients improve their health outcomes and even address some of those social needs within the community.
Sounds good. So you're a part of academia. You guys are comfortable in being a part of this multidisciplinary team. I see it as something that's long overdue, but it hadn't happened yet in great numbers. You tell us about your thoughts on this.
You're meaning different disciplines working interdisciplinarily to help problem solve with issues in the community? That
social worker particularly in that clinic. Like say if there's a clinic right on Broad Street, St. Bernard and Broad, and right in the hotbed of a lot of issues where parents, where families are struggling, falling apart, unemployment, all of these issues where, hey, let's see the social worker and they can help you and make a big difference.
Yeah, I think part of our challenge is helping the other disciplines understand exactly what it is that we do. Right now I'm working as a part of an interdisciplinary team with a student-run clinic at Ozanam Inn, which is a shelter for homeless men here in New Orleans. It was initiated by medical school students at Tulane. And basically they've created a model that brings in those primary professions that would have an occasion to engage this population. That would be medical school, public health, and social work. And the students basically provide those services with supervision from faculty in the various programs in order to deliver services to this population. So when someone comes in with a healthcare related need to be seen by the students in this clinic, then if they have a public health issue where they need more education about diabetes or high blood pressure or eye care, cataracts and things of that nature, they would refer them or pass them on to the folks, the students who are doing public health kinds of activities. If they indicate some need that relates to their mental health status or medication issues, they're not managing their medication very well. They may even be suicidal, or they have issues with housing, unemployment, and they don't know how to apply for unemployment benefits. They would then get passed on to the social work students who are there. So they're getting comprehensive care in this one setting, and we've got these multiple disciplines who are working together in order to do that. Now, two things get accomplished when we have a model like that. We have the client who comes in being able to access multiple services in one place. But also, it's just as important is those different disciplines. They recognize the value of each discipline, so they understand better what that discipline is doing. So when the medical school student who came to me 2 weeks ago and said, so what is social work? What do you guys actually do? So we know how to refer the clients who come in if they've got some issue other than medical. We know how to refer them to you. We know how to say to them that social work students can help you do this, this, and that. And we had to explain to him what we did. And it's interesting because he said, well, I didn't know the difference between public health and social work. I just thought you guys did the same thing. So I wasn't exactly sure why you guys were even here. And once we explained to him the multiple roles that we were able to serve in the capacities in terms of knowledge and skill that we have, then the light bulb went on, and suddenly he's like, oh, wow, we're going to be sending lots of folks to you guys because you can do a lot. These guys will only tell us one thing, but if we send them back to the social work students, they might be able to get more information that's going to be better able to help us to attend to what some of their medical conditions are. Because in this situation, the guys are either in crises or they just want to have the need met right then and there without giving sufficient background information where the medical person can be fully informed as to what's really going on in the situation, so they know how better to meet their medical or health care related need. The social worker can give additional information in talking with the individual that might serve them better than not just having that, I guess, presenting medical issue and understanding that there are some other issues at play here that are impacting this presenting medical issue. And we have that to come up quite a bit in that kind of setting. So it's really important for other disciplines to know what it is that social work does, so then they know how better to respond to the psychosocial needs, if you will, of folks who come in to see them, and know who to send those people to, or to bring us in to help them better meet the needs of those clients that would come in just for a health-related issue, when in fact they have multiple issues that need to be addressed that could very well be impacting their health-related issue.
Amazing.
Yeah.
Amazing. I had a guy, he had been homeless 4 years, still homeless. Brought him to the clinic, nobody could help him. Okay? Brought him to a physical clinic, emergency room, nobody could help him. Brought him to a mental health clinic, nobody could help him because his issues weren't pressing. There was no institution to help. It just doesn't exist. But social work is the institution that we can do that. I mean, looking at it from the healthcare bill, they're debating the healthcare bill. If we're going to improve the health in the United States, if we're going to, let alone Louisiana, New Orleans, if we're going to improve the health, unless we deal with structural family issues, educational, job, those things that make a difference. People can take their medicine all day long, but if they're homeless, it's irrelevant. They can, they can learn about diabetes and so forth, but if they're dealing with so many structural family issues and divorce, how has this not been on the priority list of Congress or anyone with purse strings as of now? What are your thoughts?
Well, for in many instances, and in this state, when social workers are involved in the health care or mental health care, we are not seen as individual providers able to enroll as an individual practitioner and bill the larger entity, the Medicaid program, directly. We can bill third parties and we can bill Medicare, but in this state we're not able to independently bill Medicaid. So we're in the Medicaid world, we're part of a bundled rate kind of, we're just a component of another larger system. And as my colleague indicated, many times our partners in those larger systems don't necessarily see the value of the social worker's intervention in their patients' lives. And many times we're not, even in the hospital setting, we're not involved in their discharge until the date of discharge. And discharge planning, ideally, from the social worker's perspective, should be begun at the date that patient is admitted. We should be working with the patient and that patient's family to determine what would be a successful transition from the inpatient setting to a lesser restrictive setting. And so when we're dealing with it on the date of discharge, it's kind of, maybe it's a little hurried and all, and patients aren't really sure who we are. And so, and many times it takes us, we want to develop a relationship with our patients so that we can do a thorough assessment and find out what are the other external things going on in that home. So, for instance, if we're going to be discharging an elderly patient to their home, is the home suited for that patient to be discharged with a hospital bed? What's the access to that home? Can that patient get around in a wheelchair? Does the patient need a wheelchair? Do I need to work with the family to get some durable medical? So the social workers get involved and help the family take apart what are going to be the needs within the home setting or the community setting to try and help that family, help that patient get those services and put them in place so that they can stay at home. We would like the patients to stay in the least restrictive environments as best we can. And that's their role.
And in fact, when we really look at it, social workers, in all parts, being in primary care clinics, it won't cost a lot Okay, I don't see it costing a whole lot of money. And let's look at it this way. Is there any other method? Is there any other way to really impact a family other than through what you guys are trained to do? Are we talking about something that there's another way to do this?
Of course not.
We don't see it.
I'm be honest with you. I mean, all right, okay, they're biased.
We're biased.
Yeah,
We're very biased because this is our trained profession, and this is our passion.
We're trained to do. You know, we're trained to help families function optimally, and if they're not, figure out the processes that need to take place in order to get them to a point where they can do that. And this is what we do on a daily basis, and not just families, but individuals and communities, and even working with institutions, so that whatever policies are being passed, it helps supports the individuals, communities, and families' abilities to be able to function optimally. That's good for everybody. It's not just good for the folks that we're helping, it's good for everybody. If we're all doing, well in terms of health and mental health, and employment and education, and even recreational kinds of things. If those opportunities are available to all of us, that means we all benefit.
Question. Okay. Two things. One, social workers do so many things. Could it be that you guys do so many things that it just kind of blows people away, where they really they lose ability to comprehend it? Could that be? Secondly, though, let's start looking at it even individually. Life expectancy. Life expectancy is related to a whole lot of different things, but many times it is related to families that are socioeconomic conditions of the family. The family's impoverished. It can affect life expectancy. Not following up on taking medication, or breakdown in family structure, and those different things. Let's look at just life expectancy. How would social workers impact life expectancy if they were able to see patients in a primary care clinic?
Well, I can think of an example. So let's say, and I'll use the example of some of the men that I would see coming through some of the shelters in the city. Let's say we've got a 45-year-old male who has a history of high blood pressure, diabetes, and hasn't, maybe we'll say a 55-year-old man, hasn't had a prostate exam, okay? And all of these factors, he's African-American male also, and he's homeless. So all of these factors put him at significant risk for having multiple health-related issues that could potentially end his life at 55. The social worker would begin the process of not only assessing what his health-related issues are, but then we would look at things like, say, what kind of supports do you have that can help attend to your blood pressure and diabetes, and ensuring that you would get a prostate exam. Are you connected to your family system? Do you have some kind of social network that you are working with? Are there other entities involved in your care besides the, let's say, primary health care clinic where the guy comes in for services? Have there been other folks who have provided some kind of health-related support to him? Do you have housing? Are you able to work? What is your source of income? Are you able to get a meal on a daily basis? Do you even know, in terms of mental health and orientation, what day of the week it is? Who's the president of the U.S.? Or, is this person able to speak in a manner where it's obvious that they're functionally okay in terms of cognition and psychologically? So we assess in a lot of different areas. All of this helping us to determine what are the risks for this person, and once he leaves this clinic, what those risks are, what kind of an impact are they going to have in terms of whether or not he's going to live today or be at significant risk of having a heart attack because he can't get his blood pressure medicine when he leaves that clinic. Because yes, the doctor gave him a prescription, but now he doesn't know where to go to get it filled. He doesn't have health insurance. He can't pay for the medicine. We help him figure out where to go get that. If we don't give a direct referral for where to go, we might be able to facilitate getting that prescription filled either in the clinic or somewhere nearby, or to give him a couple of days of meds until he can get it filled. But we would assess for all of those kinds of things in ensuring that at least by the time he leaves the clinic, we have some sense of what the risks are and what kind of preventative strategies we can put in place in order to pass him off to somebody else who can then provide more intensive kind of supports for this individual. So if we're talking about life expectancy for this 55-year-old man, he's at great risk of dying today, okay? Mm-hmm. But once he comes in and begins to work with a social worker, we can put some strategies in place so that the risk is decreased, or there's less risk for him in terms of his healthcare needs, in terms of his housing needs, in terms of income needs, and whatever other kind of needs might be present there. So that would just be one sort of minimal example in terms of influencing or helping to minimize the risk for there being a death today versus this person being able to have a good quality of life for the next 10, 15, 20 years.
Awesome. I think we can duplicate that for infant mortality, incarceration rate, and all of the other health indicators that have Louisiana down at fighting either 49th or 50th. Sometimes we lose the battle and end up at 49th, but usually we win and end up at 50th, depending upon what year that we're dealing with. In each of these areas, I think it would be almost the same type of scenario where the social worker would come in before the kid goes to jail, before the kid gets arrested, to see issues that are there. If they're seeing the social worker regularly along with the physician at the clinic, and if the kid's not going to school, the school social worker can contact them. Do you think that this modern technology, this new age, we were touching upon that, has made this concept possible, whereas maybe 10 years ago the clinics didn't have that?
I think so, because they can be envisioned to be a one-stop shop, and several of the larger support systems, food stamps, some of the eligibility for some of those programs are now available to where someone can apply for those benefits online. And the social worker in some of these settings could be the one to sit with the patient to complete an application to access eligibility and access those benefits that are available to them. So yes, I think we're moving in that direction, in that, when we work within systems and understand the proper application of how can those systems benefit our patients, I think we all win.
Well, we'll have to say that the time is coming. I think it's now. New Orleans, I think nationwide, but definitely in New Orleans, definitely in Louisiana, there should be no reason why social workers shouldn't be in primary care clinics all over the city, where families need to have this help. You guys can help. You guys can help families. You can help impoverished families. You can help all types of families, and all of the services that you're the best kept, best thing, better than toast bread, but nobody knows about it. Right?
Right. We think so. We think so.
Yeah. Look, I am sold on a profession. I really, really am. I have to say, this came about. We've been fighting on homelessness. And everybody knows health issues. We've been pushing homelessness because we said we're about health, but what good is it talking about health if somebody's homeless? What good is talking about health if there's no housing? And so we've really been fighting in this area, and then so it's coming about now where the concept of social work comes in as the answer. We believe it is. Senator Vitta, Senator Landrieu, Governor Bobby Jindal, do whatever you have to do, whatever it takes. We think the time is now. Republican, Democrat, or whatever can make a difference in this country. Great social workers. We appreciate you. Chris Sylvain, Health Issues. You can catch us on the web, healthissues2010.org. Thank you so much. We appreciate you.